that political and non-essential gathering be banned forthwith and with immediate effect to ensure that we can address the issues of the rising curve. The 6 billion worthy of PPEs lying at KEMSA be released and distributed to health facilities across the country, including and not limited to Baringo, where currently we have no facility with any PPEs. Every county to have adequate and fully equipped designated isolation facility for healthcare workers. The government to take care of all hospital bills arising from COVID-19 treatment for healthcare workers, irrespective of the facility of admission because of availability and accessibility. All health workers with pre-existing disease and condition, those who are pregnant and those who are above 55 years of age, be excused from active duty until this transmission is actually addressed and managed. More healthcare workers be employed to manage the rising curve, COVID-19 morbidity burden in the country. Public health treatment teams to be released to the community to carry out robust health risk communication and education.
We are in the second phase of this pandemic, and there is an obvious surge that we really have to take care of ourselves. In this, we really encourage you that if you are not on proper PPEs, kindly avoid attending patients because that one is a recipe of infection. I would also wish to talk to the general public that now we have what we call community transmission, that they have a responsibility to take care of themselves, to wash hands, be on a masks, and also maintain social distance. And we also advise them to avoid these social gatherings, and especially those ones which is pulling a lot of crowd, like political meetings.
The Ministry of Health guideline provides that for every health worker working in outpatient, they should be having an N95 mask and eye protection. If you are to walk across PGH, you will find that all of them are in surgical masks. And it's because of lack of the right PPE. That is the reason as to why we are having surging cases of infections among healthcare workers. The consequence of this is that you'll have a good number of us either in quarantine or in isolation, and we will not be able to take care of Kenyans. The second thing, because of the abandon and the casual way in which the influential people who are supposed to be models to the entire public are treating these measures, then we are going to have a surge in the cases in the community. As we talk now, some of the facilities like MTRH are actually full. In the coming weeks, you will not be able to get a bed in ICU.